All right. So this is over 4 years follow up, and a lot of my patients want to know what's 1 year, 2 year, 3 year, and 4 years, and Chris, thank you for doing a follow up with me.
Of course.
We're back.
I'm getting used to this.
It seems like is you're a pro at it, man.
Yeah.
and thank you for meeting a couple of my clients actually, and
Wow.
and one of them recently told me that he met you in person, and it really put him at ease because he actually talked to me 10 times
Right.
doing consult before I do surgery, and I just did his 6 month follow up, and
Right.
his hair density is fantastic.
Yeah.
And he loves it, but he say, man, of course he say his won't be compared to yours, cause you're like one of my billboards,
Mhm.
walking billboard. But he's extremely happy because he's saying seeing real life patient, not just photo and not just video, but real life patient really help him put at ease too. So thank you for that.
Yeah, I don't mind doing it. I mean,
Yeah.
I love sharing my experience with people, and I've been there, so whatever I could do to ease people, because like I said, I felt the same way as he did, and to be able to talk to people and just give them reassurances, to help out is wonderful.
Yeah, it's good. So what you been doing up to during the COVID now?
Well, COVID, of course, has shocked everybody, right? And so during COVID, I went to Georgia actually and spent some time with my family, and I was there for 3 months. And of course, everything shut down. I couldn't cut my hair, and I'll tell you, and I sent you pictures, right, Dr. B?
Right.
But my hair was like down to my chin, and then it got to the point where in the back it started to curl. And stuff like that, but I didn't get a haircut for 3 months. It was annoying me, so I slicked it back. But it was cool, I played around with it, had some fun with it. But recently, a friend of mine, his girlfriend, actually was studying to be a barber, and she cut my hair, a little bit here and there in the back. So I'm happy, you know what I mean? Just the way I like it. Yeah.
The patient asked me to look at your top. So can you look down for me?
Okay.
Yeah. There you go. See. Yeah, look good. Okay, good. Your hair is long.
Yeah.
So just to remind people, other client what Chris used to look like, and we're gonna show the audience what was he look like here, and that was him 4 years ago, right before.
Yeah, 4 years ago.
Right before we did his surgery, That was that, and and then. Let's look at some of your...
Oh, the ones I sent you?
Yeah, let's look at that one. Sorry, that's my daughter. So that was you right there.
Yeah, that was actually, whenever I sent you that picture, that was like during COVID, right? And that's
You
when
went to
I started.
Comb your hair down.
Yeah, because this is right after the shower, and I put what's that? The minoxidil foam in there, and then I blew dry it, and and then this is how long it was. You can see it was down there, and actually it was even like,
oh, that's bad hair.
It's fun. I decided to take a picture like that and send it to you, get a good laugh, right? It's like the Kramer look.
Yeah,
right?
yeah. And
Wolverine.
Wolverine. Are you auditioning?
Yeah. I heard that Hugh Jackman is gonna, step down, so I decided that maybe I could give that a try and, win a little role here as Wolverine.
Yeah. So that's that, and so let's talk about some of the do and don'ts and the follow up, because I have a lot of my patients ask me, I read online after surgery, online they keep saying about saline and those stuff.
What is saline? I have no idea.
Spray on wet saline on the head, I'm pretty sure you've seen that. So, but do you do that?
I absolutely don't do anything, and that's a good point that you brought up, because a lot of people still ask me, and I had a friend who recently did his hair transplant with you, and he did also the strip method, and I told him, look, he's all, wow, your hair still looks amazing after 4 years. How did you maintain it? I go, well, besides from using was that finasteride, right, and minoxidil, right, and biotin, I make sure that I follow directions, and it's a simple thing, you know what I mean? I remember when before having surgery, just like everybody else, I had concerns and I was afraid, anxious, and stuff like that. But I remember coming to talk to you. You told me what to do and what not to do. I followed that, and then after surgery, the post-op, I followed the sheet there's a post-op sheet that you give everybody, and I read it over and over and over again, because you know, you sit at home, you have nothing to do, you read it, right? And I made sure I followed it. I didn't put anything that was not on the sheet, and anything that I wanted to put on before, I would give you a call and make sure that it was okay, and you tell me, no, don't do that, don't do this. So
always run by me.
right, always run by the, you know, so if you have any, you know, ideas of putting, you know, any type of solution or potions on your hair, just don't do it. You know, call the doctor's office, talk to him, and to the ladies, and see if it's okay to apply anything before you apply it. Because, you know, a lot of people, what they do is they go online and say, hey, I had a friend who did it as well, and he you know, he goes, hey, you know, I want to apply this and that. I go, don't do it. I mean, if the doctor says no, or it's not on that sheet, don't do it. He's, oh yeah, but I saw it on YouTube, and this guy was doing it from this and that. I go, look, he's doing it, you know, because he wants to do it, or maybe he has another doctor, but do not do it. You know, whatever Dr. Diep tells you to do or not do, follow that direction. And that's what I do, and then I think that's why I have a good result. And on top of that, you know, I come back and I get the A-cell injections, you know what I mean? Because I know that helps out, and it's worth it. And then I've been doing it every 6 months or so, and to me, it's definitely worth it. And, you know,
yeah, so that's good, the do and don't, because, you know, right after surgery, you know, it takes around 3 to 4 days for the root to sink in, right? To cement in. But not everybody here is exactly the same.
Right.
So sometimes it might take up to a week. So anything that you do can cause the hair to fall off the first week. It won't grow out well. And believe it or not, people not following my instruction. They came to me for a reason, and that's my result is good. So then logically, they should follow my instruction. Not other doctor who tell you stuff, and then they don't show their result, or their result is bad, and give kind of weird advice. So one of them that bugged me a lot is using saline after surgery. And then, so there's 2 reasons wrong with that. And again, number one, when after surgery, your hair graft is already held together, is by the recoil force of your skin to try to hold the hair graft, but nothing hold the hair graft. And then you have a little scab, and the scab, your body produce that, and that the scab actually trying to hold the hair graft onto your scalp. So you don't want to do anything to weaken the scab. So by doing spraying saline on the scalp, guess what?
Just moisturizing
it moist, and it weaken the scab.
Makes sense.
And you fall off easier. So you don't want to do that. So number one, don't use the saline because it can cause the scab to fall off. Number two, why I don't like the spray and the saline is it bring a lot of moisture. And the saline, sometimes the way you store it, and we don't know how sterile that is, and it can lead with more moisturizer and more what do you call it, and it might not be sterile. Guess what? It has a high chance of infection. If you got infection, folliculitis, you're not gonna have good result. So don't do anything to ruin the the result. Don't do spray, so it weaken the hair graft and fall off easier. Don't use the spray because it can lead to infection.
And you know what, Dr. Diep, I didn't know what saline was, and I never used it. You know why? Because it's not in your post-op sheet. So I never use those kind of things. So
that's the point that I want the audience to understand, and they keep asking me why, and that's the main reason, you know. And so we don't want that. And I had a couple patients actually did get folliculitis from afterwards spraying it, and then so then I had to treat it. And you know, lucky his graft, he came to me early enough. His graft came out, you know, pretty good. And I wouldn't say pretty good, very good, you know. But he was lucky enough that's early. But if some people, and then that leads us to some other stuff that you were sitting here and you overheard what I talked about earlier, right?
About dyeing hair. So you know, again, you know, don't dye your hair unless the doctor says it's okay, because I guess dyeing your hair is chemicals and stuff like that, and it could cause inflammation of your skin, and you know,
you might be allergic to it.
Yeah, you're allergic to it and stuff like that. But yeah, you know, again, why would you dye your hair during the process of of recovering or anything like that? Because you know, you're just waiting for that hair to grow, you're waiting for it to heal, right? And you don't want to risk anything, you know what I mean? And then some people they do it, and then they get inflammation, or they lose their hair graft, or what, and you know, and again, you do that, then you know, you're only risking you know,
Yeah.
the
And
results.
we don't know. I mean, what brand patient buy from, what country they buy from.
Right.
We don't know what chemical that can cause your skin to be allergic to.
Right.
And if your skin get allergic, and then one of my patients got pus on it, and it will inflame the skin. It will affect the result. You know, it's you know, you and I, my patient want to have good result. I want to have good result
Yeah.
because we both put a lot of effort into this, and just please follow my
Right.
instruction. And if you really want, I really don't recommend dye for a year, but some patients they can't go out without dyeing. Fine, you know, maybe 3 to 4 months. But this client that called me and say that he's allergic to this dye, so if that's 3 months out, and it can still be affected. So if when in doubt, try not to dye the hair. But if you want to dye, try to use maybe henna.
Oh.
You know, make something that is very natural, something that herbal that you're not allergic to. But if you can go without it, please don't do it because it'll be out of my hand. Because once you left my clinic, I cannot be with you 24 hours. And so, you know, follow my instruction. Read my instruction.
Yeah, read it.
And I think you read it probably 100
Oh,
times.
when I'm sitting at home at that night, I'm reading it, do it, and then I double check, triple check it. And you know what? I'm very fortunate I never had to dye my hair because after you did the surgery on my head, I have a lot of black hair, so I'm very fortunate. You know, yeah, I get some gray hair on the sides and stuff like that. I have a few here and there, but I'm very fortunate to never have to dye my hair. And you know, I tell this to people. I go, look, after you get the transplant, why dye your hair? Because I'll tell you something. It's better to have gray hair than no hair. Right? Better to have gray hair than no hair. So if you want hair after surgery, don't risk it, don't dye, don't do anything, don't put potions or anything on it.
Yeah. And then you and I did talk about Derma roller, right?
Derma roller, yeah, because I asked you about that. I go, it was, and you said, no, don't touch, don't do Derma roller. You know, because you know, some people was asking like, hey, you know what? Why didn't you try Derma roller? Then I go, let me go talk to Dr. Diep about Derma roller. And so I talked to you about it. And you said it was not a good idea because it, you know, if you're doing the derma roller, you said something about the scabbing afterwards could kill the follicles and stuff like that.
Yeah, so what happened, derma roller, the idea sounds great, but it's not really, don't need it. Basically, they roll the scalp, and you start the bleeding, and you bring thinking about more blood supply, and then you can apply medicine, and you go in either. But that's not good, because derma roller causes a lot of bleeding. That means it will cause puncture through the skin. When puncture through the skin, it will cause scarring. Scarring is the #1 cause for hair loss. Yeah, not just genetic, but so the scarring will go deep down to the roots and will kill the root. It will choke and kill the root. So then you're gonna have more massive hair loss. So derma roller will not only kill your transplant hair, it would kill your native hair as well. So you absolutely do not want to do derma roller.
Oh, so you're saying like the scarring will kill the
hair
donor area, the hair follicles, exactly.
Yeah.
And you know, well, of course, you know, genetics is #1, and then you know that. You know.
And then you know what's popular nowadays is PRP.
PRP, yeah.
Yeah, you talk. You know how you take out your blood, you spin it, then you inject it, and all stuff. But you know your scalp is not hair loss, not lack of blood supply. Matter of fact, when you nick your scalp, you bleed all over the place. So why would you take out the blood from your skin and spin it and inject it on the scalp? You risk of introducing more bacterial infection. But you know the data, some of the data say, oh, it might help with the improvement. Those are weak data, and it's never been really proven it. And most of my patients who use derma roller, or I mean PRP, and in the past, and they say I tried that for treatment 6, 7, 7, and it didn't work.
It just costs a lot of money.
Yeah, 4,000 to 5,000, 6,000, and guess what? And then they end up saying now it didn't work. I'm gonna do surgery. For me, I don't do anything that I know it won't work. I only know like. I support Propecia, I support Rogaine because they have medical data. Right. I support, you know, like Nizoral shampoo, kind of weak, but it doesn't cause harm. You understand? So when it doesn't cause harm, hey, I don't oppose to it, but it has a weak data, why not? It helps.
Especially with people with dandruff, right?
Dandruff or antifungal. So some people have fungus infection, but one side effect is help you with hair growth. So why not twice a week? I'm okay with that. I don't oppose to that. And matter of fact, I do support that. But definitely, you know, derma roller, I don't support it because it can cause hair loss. PRP, if you do too much of it, in a lot of injection, guess what? it would cause scarring.
Oh,
Scarring
right.
would cause
Right,
hair
there's
loss.
too much injection.
Yeah, so that's another thing I don't support. But however, you know, I support maintenance for like once a year
Mm-hmm.
for ACell or
ACell.
amniophil.
Right, which I kinda get.
And now people ask me about laser. Now, when during my time in Beverly Hills, when I was training in Beverly Hills, I did a study on it, and I don't see any different.
Right.
So, if you ask me would it work, no, it won't help.
Mm-hmm.
But if you ask me, would it cause harm, I don't know.
Mm-hmm.
So that means I don't oppose to this
Mhm.
for laser either. But if you ask me, it won't work.
Right.
But so then if it doesn't cause harm, I don't oppose to it.
Right.
So that's why like biotin, you take it.
Mm-hmm. Gotta take that.
Yeah, you know, it doesn't cause harm. Will you ask me 100% work or not? It's questionable. I don't think so.
Yeah,
But
it's
why?
probably good vitamin too.
Yeah, but why not?
Right. Why
Why
not? Right. Right.
But PRP, derma roller, I don't like to do
Okay,
that.
got it.
Okay, so you know, and that's important for us because, you know, we don't want to do anything to jeopardize the result.
Right.
Yeah, and you emphasize that with many of my video.
Yeah. Yeah.
And
Because I get a lot of people asking me all the time, like, what do you do? What do you do to maintain? And how come your hair is still great after 3 to 4 years?
Mm.
Well, I just tell them the truth. What
Yeah.
I'm doing. I don't do all those other things that is not recommended by you.
yeah, so you follow my post-op instruction to the T.
Right. You're my doctor. You gave me this great result. So yeah, why not? Right.
And then after surgery, is maintenance is important.
Right. Right.
And what is
Absolutely.
maintenance? Propecia and Rogaine.
Right.
You know, and that's help.
Right.
Now, you know, if you're not a fan of Propecia, fine, at least Rogaine.
Mhm.
But you know, at least use medicine for maintenance
Right.
because otherwise you're gonna go chasing do more hair transplant,
Right.
which I'm okay. You know, I would like more money, but I'm just kidding. But you know, the reality is I want to help my patient
Right.
to, you know, keep the investment to last longer.
Right. Right.
And how would you do that?
Mhm.
Medicine is a maintenance.
Yeah, maintenance.
Yeah,
Absolutely.
and you're doing a good job.
Thank you.
You know, 4 years, you know, and it's good. But unfortunately, you know, with hair transplant, with everything else, nothing in life will last forever.
Right.
So on average, people around 7 or 10 years, but sometimes even 20 years,
Mhm.
they come back for touch up. You know,
Right. Yeah, because natural aging, right?
your body
you're
breaks
gonna,
down.
Yeah, you're gonna lose some bit, of
Percentage,
hair.
yeah.
But then I know that I'll still have this great hairline, and it's
But-
not won't be as dense as
Uh-huh.
after 10 years, but it will probably still look great.
Yeah, but having 1 or 2 decades of good look like you have, getting back your life,
Right.
getting back your happiness,
It's worth it.
it's totally worth it.
Yeah, I mean,
Yeah.
I want to do it for now.
Yeah.
I gotta live for this moment.
Yeah, because you know what, we're not gonna live forever, right?
Right. Right.
But in again, when we do hair transplant,
Mhm.
there's 2 things that you and I emphasized in the past. You never based on price,
Right. Absolutely.
because someone's cheaper and just go do it or go out of the country. Those are dangerous.
Right.
And then you base on the result.
Right.
And you never base, number 2, you never base on location.
Right.
Just guy down the street is, more convenient.
You have people from all around the world. I know that
Yeah.
because I've been in the office and and people it's like, oh yeah, I just came from this country to that country, and
Yeah.
they meet me
From Asia,
Right.
from Europe, Middle East, even
Yeah.
Africa, you know,
Yeah, South Africa as
and
well.
quite a bit of celebrity around the world, come for me.
Right.
It's not for price, it's all about the result. And a lot of them, they're really scared to death when it comes to like walking down the red carpet
Mhm.
and afraid that people notice they have hair transplant surgery.
I can reassure them, doctor. No one has ever said, "Oh, that's a great hair transplant you have." A lot of times, I told you before in my videos before, I go out to the bars or whatever, and the way I style my hair, sometimes I style it up or shave it close on the side, but the hair is nice and high, and the hairstyle they really like it. And the girls, the bartenders, they'll go, "Hey, I really like your hairstyle." They never go, "Hey, I really like your hair transplant." No one can tell. I promise you that. No one.
Yeah.
Because my hairline is so natural, and
Well, it's just like you mentioned one of your girlfriend.
Yeah.
She have a friend who say, "Hey, this guy should be a hair model."
yeah, I got a kick out of that.
Yeah.
Actually, I mean, I couldn't believe it, because when she sent me the picture, he goes, "Wow, this guy should be like a hair model on the hair magazine. He looks like a guy." you know, because I guess, you know, my hair was really, really nice that day when I did it and I sent her a picture, so it made me happy, you know.
Yeah. And it's good that you show me that you have bad hair day, which is your hair is all messed.
saw-
Oh, you play with it, you know, like Wolverine style. You know?
Yeah, you gotta have fun with your hair. I mean, now you get it back, you know, and I tell people all the time, when you get your hair back, if you're just gonna leave it, you're just gonna have a lot of hair. You need to play around with it to find the best hairstyle for you, you know. And this is the best hairstyle for me, and I love it, you know.
And again, I want the audience to know that the result vary from one individual to another.
Exactly.
Not everyone can have a perfect case like you, okay?
Right.
And you know, but sometimes some patient gonna need more than one surgery.
Right.
I mean, that's the reality.
And you were honest with me too. You told me that, you know, I might need 2 surgery if this and that, but we were able to get 5,200 grafts in one sitting. And that's why I only want one sitting, right? 5,200 grafts. At first, remember, I wanted to do an FUE. You say, well, if you're gonna do an FUE, the realistic part of it is you're gonna come back for a second surgery because you need 5,000 grafts. Right?
Or more.
Or more.
Or 2 or 3 surgery, or sometimes 4, depending how aggressive hair loss is.
Right, and you remember when you first told me, you said that I'm going to get 5,000 grafts, but I was lucky because you got more. Sometimes you're unable to get more, or the amount that you get because, you know, people's hairs are different, right?
Yeah.
The color of the hair, the thickness or whatever, and I understand that. And so.
And how dense your hair is, number one, and how loose your scalp is, you know.
Right.
Yeah.
And you prepared me for that, so when you told me that you were able to get 5,200, I was elated. I was like, wow, great. You know, this is more than I expected. You know.
In a perfect world, I want every patient to be like you.
Right.
You know, and because I want, you know, I want my patient to have a perfect result. Because every surgeon, I don't, not every surgeon care, but for me, I'm very passionate about my work, and I care about my result, and I take, you know, pride in my work, and that's why I want, and I try my best to give best result for every patient, but not every doctor will bat 100%. You know?
Well, you know what, you're being modest because I see a lot. You said that, you know, my perfect results or whatever, but I've seen a lot of your patients and they have great results, and some of them I consider way better than mine. You know what I mean? And yeah, so you're just being modest. So you do have a lot of great results, and you know.
Well, thank you. That's very kind of you.
No, seriously, it shows. You know, and that's what I like about you, Dr. Diep, is you're upfront, you're real. And you know, I've heard you turn down patients too, because you know, if it's not the right fit, you're not just going to do it to make money. You know, you want to make sure that it's the right fit before they can do it. You know what I mean? The right timing for them, right? So yeah, so that's how you know is you know, you're a good doctor. You know?
Well, since you've moved to Georgia, so I guess it's gonna be very hard for us to do a video all the time like we do now. But you know, at least come back once a year. So because the 80 you know, a lot of our viewers they want to do a follow up and see your progression. And you're being very honest and for and talking about, you know, your result and those stuff. Oh yeah, by the way, you told me when you visit Georgia recently.
That guy.
Yeah, what are you talking about?
Yeah. So I was at a supermarket, and there was another Asian guy actually, and I could see the ear-to-ear scar because he decided to shave it, and you know, it didn't grow back quite yet. But then I didn't know. I thought he just had his surgery, and it looked like he didn't have any growth or anything on it. So I was just following this guy in the grocery store, just checking out his hair, because that's what you do these days after you get a hair transplant, right? And I wanted to help him out so bad, so we went out to the parking lot. I approached him and I asked him, hey, you know, how long ago did you have your hair transplant? So what? He was kind of surprised, and so we talked about it a little bit, and he said that actually he had 2 already. I'm like, what? What do you mean 2? He goes, well, he went to an Atlanta doctor, and he did it, and he had no result the first time. And so the doctor said, look, I'll do it for free the second time, right? And so that was his result, was barely the second time. And I was like, wow. You know, I told him that I got my hair transplant done in California.
He didn't believe it.
Right. And I said, I got it from Dr. Diep, and you know, you should check out the YouTube channel, and here's his information. You know, he could fix your hair or whatnot. Then he looked at me, he goes, well, I don't understand why, because you don't look like you need any hair transplant. It didn't sink into him that I told him that I had it done because, you know, I had such a full set of hair. It didn't sink into him. I go, no.
The hairline looks natural.
Yeah,
too.
right.
Yeah.
And he says, look, he goes, what? You got your hair done? I go, yes. He goes, oh my God, it looks so natural, it looks so thick. I thought that, you know, you never had it done. I go, yeah. So it didn't really sink in with him because it just kind of went over through one ear, out the other ear, because, you know, he just saw my results, and there's no way, he thought, there's no way this guy had his hair done, you know.
Yeah. Well, you know, hair transplant, it can be done right, and sometime again might need more than one surgery.
Right.
But hair transplant is not just about density,
Right.
Chris. Hair transplant is about art
Right.
behind it,
Yeah,
and
absolutely.
and because you want to make sure it looks so natural,
Right.
you know, and that's one. And number two, when the surgeon recommend the hairline, you probably want to follow that
Yeah.
instead of really going your own style, and which I always gonna follow my patient what they want,
Yeah.
but you know it's you know there's a balance between we work together to give the
Right.
best result. I want you to express how you want it and not what you want it, but when you know and then but most of the time, you know what I recommend tend to be correct way because I don't know anything else.
Right.
You don't want me to do any type of surgery on you, but the only one thing I know of is hair and hairline. I'm a hairline guy, and I'm very obsessive compulsive when it comes to how give a perfect hairline. And a lot of my patients, when I give them a certain hairline, they say, "Oh no, that's too low. I want a higher." And then they call me back after a year. They say, "I love everything about hair, but I should have listened to you to get to have the hairline lower."
Yeah.
You know.
Dr. D, remember the day when I came in for surgery? I sat down
Uh,
and you said, okay, it's time to, you put on, you know, the little smock and you go, it's time to draw your hairline.
uh,
And then you just went, and you go, here it is. And I didn't object. I didn't say anything. Let's go. You know what I mean? And so, because I trusted you and I knew. And that's because you've already analyzed my face and, you know, measured everything and you saw the pictures before. Then you said, this is how your hairline should be, you know, based on the measurements and stuff like that. And plus, my pectoralis muscle, remember?
Yeah,
Here.
yeah.
And so you just
That's
followed
tough.
that basically, and you said, we're just going to do that.
And you know you had your old photo. You had
Yeah.
your existing hair before.
Right.
Right
Just
around
a
the
little,
area.
just a little bit. You know,
Yeah,
the
yeah, but
feathers,
you do
remember?
have those existing hair, so I based on that and knew that was around that area. So,
Right.
again, you know, it's not everything about me. I always work with my patient together. My patients and opinion and what my experience is. We work together to give the best result for the patient.
Right.
Okay, and if the patient is uncomfortable with low hairline, we do high hairline.
Right. Okay.
You know, and if the patient want a little bit more aggressive, as long within reason, I more often than not, I follow what they really wanted. So, but again, thank you for doing a follow up of the more than 4 years,
Right.
and I hope the viewer enjoy this video. And we're gonna do another 5 years.
We're
and
gonna do
6
5 years,
Yeah, yeah, and if you anytime you're in town, you
Yeah.
know, and if you feel like doing a video, I'm more than happy to do that because a lot of viewers really appreciate what you're doing because it helped give them hope actually, and they're actually seeing, you know, it's a real life patient and got the result and talking
Right.
about it and open about it because it's hair transplant is almost like a taboo when people don't want to talk about it, you know.
it's scary.
But it's such a revelation that you are very open about it and
You know, like one time I came here to visit, and one guy, he was on his way out, and he said, you know what, I've seen your video, and I know you are, and you know, you're my inspiration, that's why I came today. And a lot of people say that, and you know, it warms me, it makes me smile. I say, hey, you know what, I'm glad, you know, that I can help out and stuff. He goes, hey, can I get your number? I go, sure. So he's been texting me, asking me things, and I give him, you know, advice and stuff like that. And yeah, so to hear people say that, yeah, I've seen your video and you're my inspiration, you know, it means a lot, you know. So that's why I'm happy to do these things.
yeah, and you know, because there's a lot of hair transplant online. You can find crazy price in a lot, but you know, to guide people to the right place is really important too, right? Because you help them to not just get the the look, but the you know their happiness back,
Yeah,
you know, and
yes.
and
Your
so
own
the
personal
youth.
happiness, this is
Yeah.
very important.
Yeah, but going to the right surgeon is really important, you know.
Oh, absolutely. That's why I waited 3 years. Whenever I kept on coming back.
Yeah, I
and
talked to
forth.
you more than 10 times before we do surgery.
I canceled 3 times, remember? And
Yeah.
the wife was kind of upset for a bit, you know. But you know, but you know, it worked out all fine. You know what I mean? And that's shows you that it didn't matter. You know, I was willing to wait. You know, I made up my mind. You know, I'm not going to go anywhere else because the results and stuff like that. You know?
Yeah, and you did see your friend online.
Yeah.
Yeah.
Yeah, I saw my friend, but yeah,
Yeah,
exactly.
So that helped
Yeah,
you,
no.
and
Because
now
I
you.
actually saw somebody with the results. You
Uh-huh.
know what I mean? And so that's oh man, that's still the deal. You know,
Yeah.
at first it was just doing research online and saw you and your videos and stuff, and this raw video was like, hey, you know, is this camera working kind of thing, you know? So that's what I like about it. You know, the videos are very, you know, personable and they're real. You know.